Alright, chapter 5. Alright, we're going to be looking at tissues in this chapter. Alright, so as we look, there are four basic types of tissues we're going to be looking at: epithelial, connective, nervous, and muscular tissue. And remember now, a group of cells make up tissues, a group of tissues make up organ systems. Alright, you know, cytology is the study of cells. Histology is the study of tissue. Okay? Alright, so these are just some learning outcomes that we will be expecting for you to know as we go through this chapter. So again, the nervous tissue deals with the nervous system. The central nervous system consists of the brain and the spinal cord. The muscular system of the musculoskeletal system. Now you're learning the bones. It's important that you keep up with the bones because what attaches to the bones? The muscles, by way of tendons or directly. Alright, then we got epithelial, it covers the surface, and then connective tissue. That makes up pretty much all the other type of tissues in our body, like our ligaments, tendons, our blood cells from that standpoint. So the matrix, again, it contains special components that provide nutrients for the tissue cells. We got tissue fluid. You got, remember, 3 fluid compartments: extracellular, intracellular, and interstitial, in between the cells. All right. Some of the cells have a tissue gel that helps to coat them and to cushion them. All right, embryonic tissues. We got 3 germ layers. Do y'all remember your 3 germ layers from biology? Ectoderm, endoderm, and mesoderm. Ectoderm, that's the outer layer. It makes up the epidermis, our skin, our covering, and our nervous system. And the nervous system, again, consists of central nervous system and peripheral nervous system, brain, spinal cord, and the peripheral nerve. Inner, it covers the lining, digestive, our respiratory, mucous membranes. Any part of the body that's exposed to the external environment is going to be lined with mucous membrane. Alright. Then mesoderm is the middle layer. Alright. To Latin, this mesenchyme means embryonic tissue, muscle, bone, blood. So that forms our connective tissue barrier. Alright. In lab, we will look at slides. Mainly today, we're going to be looking at different tissues. Columnar, squamous. I think we kind of alluded to that in the last chapter, chapter 4. But fixation is when you prepare a slide. It's almost like if you did a cheek scraping and you rub that secretions on the slide, you let it dry, then you stain it, then you look at it under the microscope. Alright, sectioning. You can do a transverse, cut it in half. You can do a longitudinal, and you can do an oblique at a 45-degree angle. So it depends upon how you cut it, slice it, thick or thin, in order before you get ready to stain it. So in figure 5.1 kind of shows you the different types of sectioning and staining that you can do when you do these cells. Most of the cells that you look at, you're going to look at the nucleus of the cell, also what type of components that you might see. In terms of muscular tissues, they can be skeletal muscle, cardiac muscle, or smooth muscle. And we're going to be looking at some of the specialties associated with them. You know, skeletal has striations as well as cardiac cells will have striations. Smooth, as the name implies, is smooth. No striations associated with it. Okay, so these again just kind of curvy or transverse view, but they can be either 2-dimensional shapes when you cut them and slice them. Alright, longitudinal is LS, cross-sectional XS, CS, or TS, and oblique is at a 45-degree angle. So some of these little letters, abbreviations may be on the side, to let you know what type of section was cut out of that tissue. A lot of times, now anytime you go to surgery, you go to doctors, they take something out of you, or if they get secretions or things like that, they're going to send it to the lab. They're going to look at it, identify it, they're going to look at it under the microscope. Because abnormal cells let you know something may have been what? Changing or going on. If you got different type of cells in a particular body location that shouldn't be there, then that may indicate some other things that you want to get checked out. A smear, again, is when you rub tissue on a slide. You can let it air dry, or you can heat fix it, then you can stain it. All right. So you can spray it where some of the membranes are going to be laid out to get a better view of the cells. And in class tonight, we're going to look at some cross sections. All right. Again, epithelia, they adhere or cover the surfaces of things. All right. Avascular, A means without. So if you hear the term avascular, that means there are no blood vessels directly to the tissues. But the underlying cells can get blood supply that can then they can feed off of that. Vascular means it's going to be blood supply. All right. So again, we're going to look at some of our upper surfaces and internal spaces that are made up of glands. Okay. So again, the nourishment comes from the underlying connective tissue when the epithelium is on top. All right, well, what's some of the functions? Filtration, stimuli, because think about your outer surfaces. Can't you feel if it's cold in here? Can't you feel if it's hot outside? You have receptors on you that alert the inside what's going on the what? Outside of you. Chemicals can be absorbed. We excrete waste like when we what? Sweat and give off things like that. Also, we are protected by the adipose tissue or underlying tissue to help cut down on injury and infection. Now, we'll know that we have two types of skin, epidermis and dermis. Now, the epidermis can be made up of 4 to 5 layers. 5 layers is in thin skin, 4 layers are in thick skin, and we'll touch on that either in this chapter, chapter 6. Alright, as we mentioned, you got epithelium, you got an apical surface and a basal surface. Alright, the basal surface is going to face the basement membrane. The apical surface, it faces away from the basement membrane. But you got collagen there, you can have glycoproteins, you can have protein, carbohydrates. So they help to protect, anchor, and support the tissues. Alright, this is an example. When you hear the word simple, 1 layer. Stratified means several layers. So epithelial cells can be simple squamous. That means they are what? Flat, kind of irregular shape. Alright, or we can be simple cuboidal. That means it's cube shaped. Or we can be simple columnar, tall. Okay? It can be stratified squamous, stratified cuboidal, or stratified columnar, meaning what? Multiple layers. Pseudo means false. Right? So if you see this word pseudo-stratified columnar epithelial cell, that makes it seem like it's several layers, right? But if you look, it's only 1 true layer, and all of these, as you can look, are attached to that what? Basement membrane, right? See, stratified, they're distinct what? Separate layers, because only 1 layer is attached to the what? Basement membrane, right? Pseudo means false. Pseudo-stratified, it looks like it's multiple layers, but it's not. It's only what? 1 layer, right? Alright, so again, squamous, scaly, thin, cuboidal, square, columnar, tall. Goblet cells, these are cells that can be embedded inside of the pseudo-stratified, and they secrete mucus. And we say any part of the body that's exposed to the external environment is lined with mucous membranes. Why? They act as a what? Protector. The mucus wants to trap things to help prevent them from getting where? Internal or deep into the body. Because once they get there, then they can create infectious type of situation. Alright, this is a picture, a histological view of simple epithelial cells. You see a single row of them. Alright, they said they allow rapid diffusion. So that means things can move from an area of higher concentration to an area of lower concentration. They can secrete fluid. So where do we find them at? Alveoli, like the lungs, glomeruli, the kidney system, endothelium, lining the blood vessels, and series. So all of these do what? Fluid and transport. Alright? As things go through, things are going to be what? Moving from either high to low concentration, either going into something, or it's going to be coming out going into something else. Alright, this is an example of simple what? Cuboidal. If you look at the cells, you see the nucleus, they are what? Cube shaped. Alright, square around. What do they do? Absorption and secretion. Alright, where does this come from? This is a diagram of a what? Kidney. Alright? Absorption, your kidneys do. Secretion, they do. So they took a tissue specimen from the nephrons of this kidney. They secrete mucus to protect. You have in the liver, your thyroid gland, your mammary gland, your salivary gland, bronchioles, the lungs, and your what? Kidneys. Okay? Alright. Where did this view come from? The simple epithelium. Alright, this is the stomach. This is the duodenum. That's the beginning of the small intestine. And it goes on into the what? Jejunum. So this is part of the small intestine where they took is what? Tissue sample from. Okay? Alright, again, as we look at the simple cuboidal epithelial cells, again, the renal system, the tubular system, the bronchioles, the liver, the thyroid gland. Alright, columna. Where did this come from? We steal from where? Yeah. Okay. What does it do? They tall. Alright, simple means how many layers? One. Alright, what are these? Goblet cells. What did we say the goblet cells secrete? Mucus. Alright, and what's the purpose of the secreting of mucus? Yeah, protection. Alright? We got microvilli. Who remembers what microvilli do from the chapter 3 test? Okay, it helps with absorption. Right? And microvilli are in large concentrations where? Small intestine. Where we talk about what? Brush border cells. Alright? So lining the GI tract, the uterus, the kidneys, and your what? Uterine tube or your what? Fallopian tube. Alright, pseudostratified. Pseudo means what? Bless you. Bless you. Alright, false. Alright, where did this cross section come from? The lung. Okay? Do you see goblet cells there? Okay. Now we just saw 2 slides that had goblet cells. Right or wrong? Okay? This came from where? Alright. And we said any part of the body that is exposed to the external environment is lined with mucous membranes. What are the two most common routes in which organisms can enter the body? Mouth and breathing. Alright. So again, they got cilia for what? Movement. And remember from chapter 3, we talked about the cilia being what? Stimulated. And remember, in the nasal hairs, if something irritates your nostrils, you do what? And by sneezing, you're blowing it which way? Out. And that keeps it from going into the what? Respiratory tract. Okay? So these can be found in the urethra of the males and the respiratory tract. Alright, stratified means what? Okay, but it means what? Multiple layers. Alright? And stratified can be squamous, cuboidal, and columnar. You also have a fourth type called what? Transitional. And we're going to find the transitional epithelial cells in the bladder. And why do you think you found them in the bladder? What's the purpose of the bladder? Yeah, it stores urine for you to urinate. What stimulates you to go urinate? I asked you what was the purpose of the bladder. You said urination. Urine is stored there. What stimulates you to go urinate? Huh? Well, stretching. Your stretch receptors. As your bladder gets full, it does what? It stretches. So that gives a nerve signal to make you go what? Forward. So the transitional cells help with that component. Okay. Alright, again, they make up some of the deep layers. We have keratinized tissue and non-keratinized tissue. Alright? What's the difference? Where do we find keratinized tissue? Alright, and what is the role of keratinized tissue? Huh? How? How does it protect you? Keratinized. How? 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 Come on, think. What happens when your skin gets dry? It breaks. It cracks. Alright, so keratin is a waterproofing agent. It tries to keep the skin what? Moist. Because when it gets dry, what happens with your lip when it gets cold? They peel, they crack, and when they crack, it allows things to get where? Inside the body. Alright, non-keratinized tissue. Where do you find that at? Non-keratinized tissue. Well, now think about it. Huh? Non-keratinized tissue. Let me ask you this. If keratinized tissue is on the parts of your body that needs to retain moisture, right? Name me places on your body that's already moist. Your mouth, your vagina, alright? Your eyes. It is already what? Lubricated. So that's why it's called, because it does not need to be what? Waterproofing, because they're already what? Moist. Alright? Make sense? Alright. What is exfoliation? Dead skin. So how many of y'all exfoliate? Alright. Sometimes. Right. But it's good to do that. Yeah. I mean, how many of y'all do pruning? Well, yeah. I mean, how many go to the hairdresser? All right, and what do they do before they do anything? They tell you they got to do what? Wash it. Then what they got to do? Huh? Oh, then after all that, they got to clip your split ends. Why? All right then, you got to get rid of the dead so the live then what? So that's why when you prune trees and shrubbery, you're getting rid of the dead stuff to make room for the what? Living things to go. Alright? Make sense? Alright, this is keratinized. Alright, epidermis, palms of the hand, soles of the what? Feet. Alright? It helps with what? Resistance, abrasions, and it want to keep things from penetrating the body. When you see the word pathogenic or pathogens, what does the word pathogen mean? A germ. But give me a little bit more specific on that. Huh? I mean, it's unwanted, yeah, of course. But give me something else. A pathogen is an organism that can cause a disease in a healthy individual, which is different from an opportunistic organism, is one that can only make you sick if you have an immunocompromised condition. It's like the germs that can hurt diabetics or people with AIDS. They can die from a common cold. If you're healthy, that organism can't bother you. It's like thrush. Baby gets thrush, right? Do you expect adults to have thrush in their mouth? Alright, so then a lot of cancer patients, AIDS patients, they can get what? Thrush. Diabetics can get them. But that means there's something what? There you go. Physically wrong with that individual. Alright? Alright, here we go. We look at stratified, non-keratinized. Esophagus, where's the esophagus? Alright. Or mucosa, tongue, vagina. Already what? Moistens the area. To help prevent what? Pathogens from getting in. Alright. Your stratified cuboidal epithelial cells. Where's this cell coming from? That picture's where? Your skin. Alright. You got two layers. The epidermis and the dermis. Alright. You got sweat glands, right? Alright. You got seminiferous tubules. You got ovarian follicles for sperm, hormone production, things of that nature. We sweat to do what? Cool off. But not only that, our sweat contains antibodies that can kill certain microorganisms that can be on our what? Skin. Perfect. Alright. Transitional. The urinary tract, ureters, and bladder. Where are the ureters? Huh? The ureters are those long tubes that come from your what? Kidneys. And the ureters go where? To your bladder. Alright. Alright, connective tissue. Now remember we said connective tissue our line blood vessels, our blood, our ligaments, our tendons. What's the purpose of ligaments? Ligament. Perfect. Connect bone to bone. Tendons. Connect muscle to bone. So they support, they what? Protect, and they got good what? Blood supply. Alright? Alright, these are some of the things. They bind organs, support them, protect our ribs, our cranium, our sternum, white blood cells to fight infection, movement of the skeletal system. It stores fat, heat production, and blood transport. Give me the definition for metabolism. We talked about this in chapter 1. Metabolism. Okay? So it's the sum of the physical and chemical processes that take place in the body. What are the two parts of metabolism? Catabolism and Perfect. Okay. Huh? Alright, let's look at fibroblast. When you hear the term blast, that means immature. Cyte means mature. Alright? So these are immature what? Fibers. Fibroblasts. Alright? Macrophages. This is a special form of white blood cells. Macrophages mature from monocytes. Okay? Their job is to circulate and to kill foreign things that they find in the body. Macrophages can be fixed in one place or they can circulate. Alright? So you can find them in your lungs. They're called alveolar macrophages. You can find them in your lungs called, in the liver called Kupffer macrophages, or they wander. They wander around as policemen. They go through all different parts of your body to try to find something that shouldn't be there to destroy it. Erythrocytes is red blood cells, leukocytes are white blood cells, and thrombocytes are platelets. What's the role of platelets? Huh? Clotting. What's the role of the erythrocytes? What do your erythrocytes do? Red blood cells. What do your red blood cells do? Carry oxygen and remove CO2 and carry what? Nutrients. Leukocytes, neutrophils, eosinophils, and basophils. They fight bacteria. They play a role in allergic and parasitic infections, and they cause vasodilation. Yes. You can read DNA on your spit, your epithelial tissue. Yeah, if you leave some epithelial tissue, if you was, sometimes if you tie a rope to strangle people, sometimes you get epithelia off of your hand, which is what? Exfoliated skin. They can take that and pull DNA off of it. They can get DNA out your hair. Yeah. They transport oxygen and remove CO2 and transfer nutrients, right? So lymphocytes, they help to protect us against bacteria and foreign agents. Plasma, that produces antibodies that also fight what? Infection. Mast cells, heparin. How many people have been in the hospital or worked around hospitals? Heparin. Why do they get heparin? Heparin. From clotting. A lot of times when they swap out IVs and things that they give you heparin. Alright, Helplock and things like that to keep it from what? Clotting. Right? They can't, no they do, there's saline to flush it with. Yeah. Alright, mast cells again secrete heparin to cut down on blood clotting. Histamines, they cause vasodilation. I don't know if you ever had a real bad cold, sinus drainage. You go to the store and get an antihistamine. Why do you get the antihistamine? It dries you up. Yeah, because histamines open you up and it makes things what? Run out. Alright? Adipocytes. What is adipose? Fat cells. They are what? Insulators. Okay? They store what? Energy. And right now, it's summertime. Animals are eating, because they get ready for the what? Winter. Alright, collagen, connective tissue. Again, tendons we talked about, ligaments, they are flexible, stretch resistance, they can be elastic, they got recoil capabilities, they can stretch and then recoil back. Elastin is a protein we found around our lymph nodes and spleen. Lymph nodes play a role in what? Immune system. When you go to the doctor, don't they palpate here? Don't they what they feeling for? If your lymph nodes are swollen, what does that kind of indicate? A sinus infection, or you got, cancer. How many of y'all do? Well, y'all ain't old enough, but as you get older, you should do what? Breast exam. Well, you know, some of you in can be high categories, like if you're 40 or more, or you got it running in your family. But what else should you examine other than your breast? Huh? You go in your armpit, your lymph nodes, right? Because when they do mastectomies, if they cut this off, they got to go in here to take your lymph node because the cancer can metastasize. Alright, so if you leave these nodes, if I take the breast off, if the nodes got cancer, it still does, you know what? Good. Alright. And if all the nodes are full, then that lets me know that it probably has what? Metastasized to somewhere else. So you want to get the regional lymph nodes to see what's what in them. Right? My future nurses. Alright. Do you take blood pressures in the side that has had a mastectomy on? No. Right. And most women who have had mastectomies, don't they wear those? Because they tend to get what? Swelling. Alright, yeah. Alright, you got what we call glycosaminoglycans, proteoglycans from this standpoint. And the purpose of these things is to do what? They regulate, they protect, they allow adhesiveness, they allow for filtration to take place, they provide shape, support from that standpoint. When you think about cartilage or chondrocytes have to be laid down, and chondrocytes are going to be replaced with bone. You got osseous and you got chondrocytes. Chondrocytes is the form, then it's replaced with what? Osseous means what? Hard bone, but it starts off what? Soft, then it's replaced with what? Bone. Alright, these is what tendons look like. Are they cadaver? Okay? They help support. You see that band around the wrist? That's called a retinaculum. When people have carpal tunnel, this thing is too tight, and you got what is called the median nerve. The median nerve the median nerve is the nerve that goes through there, and normally it's the one that gets trapped in and causes carpal tunnel syndrome. Alright? So a lot of times they have to do what is called a retinaculum release. Alright? And by releasing it, that takes the pressure off of that what? Median nerve to take care of the pain in carpal tunnel. But you got alveoli, you got reticular, this regular, this irregular. So for this, you need to know what type of tissues are associated with what. Okay? And we will look at some of these tonight in lab. Alright. Alright, again, the types of fibrous connective tissue, again, you see where they're located. They can support and surround blood vessels and nerves. They can help to remove waste. They can help supply the leukocytes to help fight off infection. Okay? Alright, this is what a tissue sample or a histological view looks like. Alright, and what is this type of tissue called? Areola. Alright? So again, look at it. It as a passageway. Alright? And this passageway, again, look what's in there. You got fibers, you got connective tissue, you found them between muscle cells. Again, foramen allows blood vessels to pass through, right? Or do y'all remember that? A foramen is the opening for blood vessels, nerves, alright, and veins to go through, alright? Alright, this is what? Reticular tissues. The spleen, where's the spleen located? Alright, left side, right side. Is it? Alright. Where's the thymus located? On where? On where? Yeah, you got that part right. It's on the body. The thyroid is up here. But no, the thymus is down over the heart. Yeah, remember? And then you got bone marrow. And the bone marrow is found in the cavity of the bone, and it plays a role in the production of blood cells. Right? Alright, this is dense regular, alright? Ligaments. They hold bone to bone, right? Elastic. But look how they run. They run what? Like parallel in the same what? Direction. Yeah. Look at this irregular. How do they run? Alright. Capsules, organs. So they help to cut down on what? Stress. Because think about it, you can get stress put on you in a lot of different what? So this is anchored and going in all what? Yeah, to help prevent that. Okay? Makes sense? Alright, what do we say about? Yeah. This regular, it allows attachment. Like bone, it holds things together. But it runs in the same what? General direction. Yes. Yeah. Stretch. Stretching and stress. The stress that you can put on your body tissues, it helps to kind of prevent it. Because too much stress will cause stuff to do what? Break down. Right. Okay. Alright, adipose. We say it's an insulator. It's a storage of what? Energy. Alright. You got the areolar tissue. Again, reticular and your capillaries. Alright. You got white fat and brown fat. Fetuses, children, and what? Infants. They help to keep things what? Warm. It is a heat generator. Alright. The brown fat. Alright. Now, the white does help to insulate too and store it. But think about it. Breasts and what? Hips. Alright. Men get it around their what? Gut. Alright. Thermal insulator. This is what adipose tissue look like. Okay. So it's cutaneous, it's sub-Q. The breast is full of what? Adipose what? Tissue, right? A lot of times when they do mastectomies, they'll go to your hip or your gluteus region and try to get what? Fat and tissue to do what? Breast reconstruction surgery. Cartilage, again. Chondroblast is immature cartilage, chondrocyte mature. Alright? They lay down the framework in which, in which bone is going to be what? Formed. Alright? The perichondrium. What does the perichondrium do? So, when you think about the ribs, what's the difference between true ribs and false ribs? They are connected to the sternum by way of cartilage. Now, the false ribs, The floating ribs are not. The false ribs, they are connected, but they're connected indirectly. When you go back, when you look at the skeleton again, at the bottom, you see all these ribs come together, but they seem like they insert in one big what? Yeah. So they are attached, but indirectly, by that blessed hyaline cartilage. Okay. Again, cartilage, no blood vessels, so they get their nutrients and remove waste by diffusion coming in. So you got three types: hyaline, fibro, and elastic. Okay. Hyaline. Where do you find hyaline at? What structure is that? No, that's your larynx at the top. The tube coming down is your trace. And the bronchi is where they what? Branch. Okay? So it allows opening for what? Airway, your vocal cords. Okay? Your coastal cartilage, the articular cartilage, larynx. I'm getting there. I just asked you where did this one come from. Yeah, I was just talking about the picture. Okay? But if you look at that, that is a what? Distinct picture. Okay? Alright, this is elastic. Where is it coming from? Ear. Okay? And you hang a lot of what? Jewelry on your ear. It's elastic, it's what? Flexible. And the what? Glottis and your what? Epiglottis. Fibrocartilage. Where you find it at? Where's that coming from? In between the what? Vertebrae. It's a shock absorption. The meniscus. Where do you find your meniscus at? Meniscus. You can find the long bone is your what? Femur. It articulates with what bone? The tibia. And the meniscus is the padding that sits on the tibia that cushions between the femur and the tibia. The fibula is not articulated with the femur at all. It is connected to the tibia by way of an interosseous what? Membrane. Okay? Yeah, it's connected to your femur. Alright, not your fibula. Alright? So the meniscus, your pubic symphysis. Where's your pubic symphysis located? The os coccyx. The os coccyx, when both sides what? Come together. Okay? Bone. Bone is what? Ossy is what? Tissue. Alright? Bone is thick. Right? Bone comes from cartilage, chondrocytes. Alright? You got the thick end, or the thick part, the shaft, and the thin end. You got a diaphysis and a epiphysis. The diaphysis is the shaft, the middle hard part, and the epiphysis is the spongy bone. You have what's called a epiphyseal or growth plate. Alright? That allows bone to do what? Grow. And when it closes, you stop doing what? Tall. Alright? So again, compact bone is the dense calcified, and sponge is the delicate ends. Now at the ends of bones, both proximal and distal, is all covered with what we call what? Articular cartilage. Alright, so wherever any two bones come in contact with each other, they are covered by articular cartilage to keep what? Bone from rubbing up against what? Bone. When bone rub up against bone, it creates what we call joint crepitus, or degenerative joint disease, or rheumatoid type of what? Arthritis. It helps with the movement and protection. Yeah. Alright, this is... Alright, it's different locations. Yeah, you got different forms of it. But articular cartilage, that surrounds the outer part. Alright? So this is fibro in between the intervertebral disc. Elastic, the ear, hyaline. These are the places. Trach, larynx, articular cartilage. So the one that around bone, like you see it, that would be hyaline. That's a picture of what? Bone. Alright? You got your concentric lamina, you got your Habergian and Volkmann's canal, but this is what we call osteotic tissue or osseous tissue. Okay? Hey sis. Alright, you got, when you look at that slide, let me go back. When we look at this picture here, there are parts of it that you want to learn, alright? So when we look at the osteome, the canaliculi, the periosteum, and the osteocytes, you should be able to identify some of these regions on the actual bone picture, alright? When you're looking at them from a histological standpoint, okay? So it's very important that we be able to identify the bones as we look at them, okay? So when we go to lab tonight after your test and you look at the histological slides, it's going to be very important that you know how to identify those structures, okay? All right, also, blood. Alright, when you think about blood, you got red blood cells, white blood cells, and you got platelets. Now keep in mind now, when you look at a picture, red blood cells have no nucleus, okay? That's why they only stain pink or red. The white blood cells, you see they stain, alright? They do have a what? Nucleus, alright? And the shape of it tends to tell you. So when they do blood work on you and they say, well, we're going to order a CBC with differentials. The differential is going to be looking at the neutrophils, the eosinophils, the lymphocytes, the monocytes. It tends to let us know if it's a bacterial, if it's viral, if it's allergic, if it's parasitic. And when you hear the term parasitic, I don't know how you all like your food, but sometimes people can get worms or cysts from eating undercooked meat. Like some people like their meat medium rare. Some people like to eat their stuff raw, sushi, things of this nature. You can pick up stuff from that. Alright? So again, we talked about the types of red blood cells already. Alright, when we talk about the nervous system, what do we look at the nervous system? What's the function of the nervous system? Okay, it allows perfect communication. Alright, so we think about what? Excitability. Alright, so the body responds to chemicals that, or hormones, that can be released that will have an influence on our nervous system. But when they mention membrane potential, all membranes have the capability to become excited. Alright? And when they become excited, it elicits a response. All membranes have a charge, a voltage charge. This is like when the heart go bad. What do they have to do? Defibrillators. Almost like when your battery dead in your car, you hook what to it? Jumping cable. So you have to give it has a charge. But it has ions that have charges. Even when you think about your battery. When your battery go dead, have any of y'all ever had to replace a battery or your? Okay. Sometimes they'll check the what? Water content in it. But you got what? Charged ions in that battery that keeps it what? Working. You got a negative pole and you got a what? Positive pole. We got negative charge ions in our body. We got what? Positive charges. So again now when a muscle is excited and stimulated, it can what? Contract. That means you shorten the distance. When it relaxes, it what? Extends back out. Yeah. Alright? Nervous tissue. A nerve cell has three parts. A axon, a dendrite, and a soma. Alright? The soma is the cell body. Alright? That's the big purple round. The things that's sticking out from it is called your what? Dendrites. And the long tube is the what? Axon. So the dendrites can pick up a signal. It brings it into the cell body. The cell body is going to determine if it's strong enough to what? React. If it's strong enough of a stimulus, then you're going to react. The impulse travels down the axon to go to another nerve cell or another what? Muscle cell. Because every stimulus you get, you don't necessarily have to what? Respond to. I mean, if you got, I mean, y'all got kids, like younger kids, you know how kids do, mama, 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 daddy, you know. And, alright. Now, you know when your kid is in trouble, right? And you know when they just being what? Worrisome. When they just being worrisome, you got a turn-off switch, don't you? That you don't get up to go see what's wrong with them. So you don't respond every time your kids holler what? Ouch. Or every time you hear noise. Alright? I know when my grandkids are over, I hear a loud thump. If they ain't crying, I don't move. Alright? It's just my nature. My wife said, you heard? I said, yeah. You gonna go see? No. I don't see no blood running from nowhere, and I don't hear nobody holler. So everybody's in good shape. Alright? They may be what? Well, shit, I can't do that when I get up there anyway, Hey, it's enough of me with each other that can come get me something wrong. Alright? Don't make me get up and I'm in my comfort zone. Now, y'all stop. I'm in my comfort zone. You know, I'm in my lazy mode. Yeah. Yeah, they can pick up signals like when it's hot, cold. Right? And think about it now, when you're cold, how many of y'all get up and go out? When you're hot and laugh, how many of y'all go up and out in the hallway? It's something that makes your body what? Respond when you can't take enough of it. It says it down the axon to another nerve or gland to make your body what? React. Okay, you got the dendrite. They bring it into the cell body. The cell body determines if the signal is strong enough. It travels down the axon to interact with another what? Cell. And then it stimulates a what? Action potential. Alright? And then you respond. Now, I'm going to put this disclaimer that you get when you take 202. Some chemicals that your body releases are excitatory and some are inhibitory. Okay? An example with that would be if you ever had any type of work done, dental, a procedure, they give you some what? Anesthesia. It raises your what? Pain threshold where you don't feel it. But when you leave and give you a prescription for a narcotic, they say go get this pill, start taking it before the medicine do what? Because once it wears off, your threshold comes back and it goes back to where it should be, and you're going to feel what? Pain and discomfort. Make sense? Think about it. Pain is better controlled if you get it on the front end than the back end. Alright. So again, we look at skeletal muscles or muscles. You got cardiac, smooth, and skeletal. They do movement. They support. Even digestion. Digestion is called, the digestive tract is called the alimentary canal, where we have what is called rhythmic contraction of the food as it moves down that canal. You got circulation, you got breathing, you can talk. All of these are based on our what? Muscles. Okay. This is what a skeletal muscle looks like. It has striations, right? It has a nucleus. It's what? Voluntary. That means you have some control over that what? Muscle. Okay? They have multiple nuclei. They kind of run adjacent along the plasma membrane. This is a cardiac. It has striations, but look at the nuclei. They are more centrally located. They have what are called intercalated discs, and we just talked about this in my 202 class. These are things here, intercalated discs. They allow for the heart cells to do what? Communicate with each other in order for the heart to contract. This is involuntary because you cannot regulate your heartbeat, your breathing. These are things that are what? Involuntary. Alright, smooth muscles. Alright, they have no striations on them. Alright, involuntary. Alright, visceral structures, hollow organs. Okay, where these are going to be located. Alright, cell and gap junction. Alright, let's take a break. Then we'll come back and finish. Alright, cell junction. You got three types. Gap junction, tight junction, and desmosome. Keep this in mind now, because I just covered this last night in Anatomy 2, and I think chapter 19. So they was talking about that, about the heart. But tight junction is a tight seal where nothing can leak through. Gap has spaces so things can interact.
That was on the test.
On which one? Yeah. But it builds. It don't go nowhere. So just because you get through with it one time, just as I said, it's in chapter what? 19. And then, yeah. And desmosomes are this mesh that help hold things what? Together. All right. Alright, again, tight junction is a tight seal, and I'm sure everybody's seen the commercial with the Ziploc bag, and they fill it up like with the red spaghetti sauce hole over the white couch, and they got a cheap bag, and they say, well, which one you want me to use? Alright, so cells need this because it regulates what can go into and what can leave the cell, like the plasma membrane, like the blood-brain barrier. Alright, and this is just desmosomes. This is mesh to help hold and interconnect things like our intermediate filaments that help to make the shape and support the cell. And this is gap. We find them connexons like between nerve, cardiac cells, embryonic cells. So different cells can communicate with each other. So it's very important to know the difference. Okay. What's wrong? What? No. They walked out, I think. I know it. Alright, when we talk about glands, again, glands, they excrete and secrete. So they help to protect the body. They help to get rid of waste from in the body. Alright, is one thing you need to learn, endocrine and exocrine. When you think about a endocrine gland, these are glands that, and I got two computers running up here. Alright. Endocrine glands, exocrine. Exocrine glands, they secrete their products directly into a duct, and it goes from a duct to a gland. Endocrine, they secrete their components into the bloodstream, and the bloodstream carries it to a target cell where the target cell will respond. So again, the hypothalamus is the gland or the part of the body that will regulate the different types of hormones that the body will release. So some of the glands, the liver is a gland, the pancreas, because it secretes insulin, the gonads, they secrete our sex hormones. Okay? Alright, so this is an example of an endocrine gland. You see the blood vessels around. It's going to transmit from the blood vessels to the target cell that carry out the function. Exocrine, they secrete theirs into a duct. And then from the duct, it's going to go to the target cell where it carries out its function. Alright, so a unicellular gland, mucus-secreting goblet cells that we find in the trach and in the stomach. And again, they expose to the external environment. If you look at this picture, figure 5.30, it shows you what an exocrine gland looks like with the stroma, the ducts, the acinar cells. You can see the secretory vesicles. They can either be cuboid, simple, columnar type of epithelial cells. This is what they could be sweat glands, mammary glands, or pancreatic or pancreas. But look how they look. Compound, they can be tubular, or they can be tubular acinar. So these are different shapes based on the concentration of stuff that they will secrete. So we talked about mucus. Again, mucin, it helps to protect. They come from unicellular cells. Mixed, they can produce both serous and mucus-secreting cells. Cytogenic, this is a cell that the whole thing is released, like a sperm cell. A sperm, the whole cell comes out. Or an egg, the whole egg comes out. Serous, again, tears. Now, tears have antibodies in them. The milk that women produce have antibodies in it. Perspiration have antibodies to kill things. Then we have our digestive juices. Please answer that one. Modes of secretion. You got three types of glands: merocrine, apocrine, and holocrine. And examples A, B, and C tells you what they look like and some of the products that they can secrete. So your merocrine, they secrete tears, gastric glands in the stomach, pancreas secretions from the pancreas. Apocrine, more lipid droplets, milk secretion from our mammary glands, axillary sweat glands. Have you ever heard the term pheromones? Alright, what are pheromones? Yeah. So pheromones are chemicals that the sexes give off, and they can be attractive, and also certain things release them as a deterrent, or like male animals, they do it to mark their territory. Okay? Alright, so these are the different modes. Holocrine, it secretes products until they disintegrate, so it bursts and ruptures over it. Like oil glands. How many people here, they may have oily scalp or dry scalp? Right? And a lot of times if it's dry, it makes your hair what? Brittle, dandruff, it breaks off from that standpoint. Our eyes secrete a lubricant to help them from what? Sticking together. Alright, now we got glands. The ceruminous gland is the gland you have in your ear. It secretes earwax. Alright? You got cutaneous, again, epidermis, dermis. They have special secretory products that they release. Alright? So again, either the synovial membrane, they line joints to help for contraction without pain. The periosteum, it lines and covers the bone. Alright, this is a mucous cell. You see the goblet cells. You can see the lamina propria under there where you see your what? Blood vessels. You see your basement membrane. And what type of cell is this? Is this a pseudostratified, columnar? Is it cuboidal? What type of cell at the top layer? It's pseudostratified columnar, because it's pseudostratified. It looks like it's multiple layers, but it's only one layer because all the cells attached to what? The basement membrane. Alright, they have the goblet cells that secrete mucus. Alright, now remember, serous, again, fluid. They are in the walls of different body cavities. You can see the fluid on top. You see the simple squamous flat layer. You see your areolar tissue, and under there, you see your smooth muscle. Alright, tissue growth. Hyperplasia, their cells multiply. Hypertrophy, they increase in size. Neoplasms are like tumors. They can be benign or they can be malignant. Now, a benign tumor is normally encapsulated. It really doesn't grow fast, and the only way it's harmful to you if it puts pressure on a vital organ. Malignant tumors, they are unencapsulated. They grow very fast. They tend to have their own blood supply, and then they can metastasize to other parts of the body. Alright, so differentiation is that once cells are developed, as they get older and mature, they convert into what they're going to do. So when we talk about a stem cell, how many people know about stem cell research? Alright, what do they mean? What's the significance behind stem cell? Anybody? Okay, yeah. I mean, let's say you got a cell that you need replaced. If I can take a cell that has not formed yet into what it's going to be, I can treat it chemically and convert it into the cell type that I want to replace a worn out or cancerous cell with. So that helps me do things. All right. Look at metaplasia, change. Now some tissue is going to change because that's what you want them to do. So when you look at simple cuboidal tissues of the vagina before puberty, but after puberty they become what? Stratified squamous. Alright? So, one thing I know that as you get a certain age, women get what? Pap smears. Why do you get pap smears? Okay. How many times you get one and they say, well, it's abnormal? Alright. But you can have abnormal cells. But does abnormal cells mean you got cancer? No. Alright? So cell changes based on your what? Activity. And that's with anything else. So when they take lung tissue, if the lung tissue cells have changed to a different type, then they can say, okay, this may have metastasized into this, and this is what? Harmful to you. Alright, so that's why it's important to know what type of cells are where. Alright, we talked about stem cells and what role they play from a medical standpoint. Alright, pluripotent, totipotent. Alright, pluripotent can develop into any type of cell in the embryo. Alright. Totipotent have the potential to develop into any type of a fully differentiated cell. Accessory organs are pregnancy. Multipotent, able to develop into 2 or more cells. Think about bone marrow transplant. Why do they do bone marrow transplants? What could you have going on? The reason why they need to do a bone marrow transplant. Okay, so what do? They can replace the cancerous cells with what? Good marrow, and then that marrow will start producing what? Normal white blood cells. Make sense? Okay. Alright, tissue repair. Why do we have to go through tissue repair? Damaged tissue, scar tissue. Alright, anytime you get a cut or laceration, the body has to do what? Repair itself. So there are several things that it goes through in order for this repair process to take place. Right. Now, is it important for the healing to go from bottom to top or top to bottom? Okay, you say what? Yes. Why?
Because on the inside, it's got the, well, I can't explain it, but you got to work your way from the inside to the outside.
Yeah, well, it has to granulate, it has to fill in. A lot of times, if this heals first, a lot of times this never heals. So you end up with ulcers and wounds that do not heal. And you can get a sinus tract. That means the infection can open up and spread other places, right? So when you damage tissue, what's the process? Well, first you're going to bleed, right? You want it to bleed because if you stick something in there and pull it out, blood is a sterile what? Irrigant. It flushes out the debris. Alright, once it does that, you want to hold what? Pressure to it. Because you eventually want it to what? Clot. Then you want granulation and fibrous tissue to come in to start what? Fill it in. You want your white blood cells to come in to kill any foreign agents that may have gotten there. Sometimes we may get a clot there. You want that clot dissolved and broken up, and you want to start new vascular tissue to what? Take in. So these are the stages you go to until you get that what? Outer scar tissue. Alright? So again, blood clot forms. Alright, you want to inhibit the spread of pathogens. You want to reestablish blood supply. Macrophages come in because they have phagocytic capabilities that they eat up and destroy foreign debris or organisms that gets into the area. Alright, so you get granulation, fibroblasts. So it may begin 3 or 4 days after, but it can last up to 2 to 3 weeks, depending upon how bad the cut is. Now, if it's real bad, you got to have what? Sutures, okay? And normally when they put sutures in, they don't just put them on the outside. They start deep and they start closing just like you want your body to close, from deep to what? Superficial. And then you want the skin to come together and approximate itself, and that should help tissue repair be over with, remodeling. I think on the lecture I did on 4, I may have talked about scar tissue, alright, or keloids. A lot of times what happens is that when a cell is completely healed, the outer part touches, right? Alright, when it touches, that should stop the granulation process. But when a keloid, when they come together, they don't stop, but they don't have nowhere to grow, but they grow on top of each other. So that's how they form these what? Keloids, right? And some cancer cells do the same. Atrophy means to shrink. Necrosis is tissue death. Infarction, you interrupt the blood supply. How many people heard of gangrene? Right? This is tissue death through the gangrene. It can be dry, wet, or gas. Dry gangrene, and you're sitting in the hospital when you do a dressing or something, the skin, the bone or the digit, it looks black, and it looks like a dried twig. And it looks like if you thump it, it'll snap off. And eventually you're going to go change the dressing one day, and true enough, it's going to break off. That's what it's going to do. Wet is more dangerous, alright? And then gas is the most dangerous because you form air pockets or gas bubbles. And if you don't amputate it or debride it and get that dead tissue out, your patient's going to die from sepsis because his blood count is going to go up so high that he's going to die. Okay? Had an older guy came in the VA. He had been in there for about 2 days. And he came in for some medical, but he had stepped on something. And his white count kept going up. And I guess it went up a little bit, then a lot one day. But it was one night we were leaving, and one of the nurses called the clinic and said, well, we got a patient, his white count is 40,000. Normal is 5 to 10. 40, that's almost septic. So we took him to x-ray. Well, I wrote an order, sent him an x-ray. He had gas bubbles on his x-ray. So we had to immediately take him to surgery. We had to amputate it, all right? So what we did was we did above, or at least a below knee amputation. But when we made our incision into his foot, he had no skin line. He had no arch. It was just a big mass. When we cut into his foot, his meat looked like that. Alright? It's like a red meat that you leave out for about a week in the heat. and then it smelled like something that had been dead for about 2 months in the heat. So it was just, when you touched it with your gloves, it was slimy, his tissue. Huh? He stepped on something, but it got gangrenous. And, you know, he came in for one thing. That's because when you're treating your patient, you can't get tunnel vision. So they kept treating him for a medical issue, but he had something totally else that was making him sick, and he kept getting sick and sicker. And just a nurse picked it up. Because evidently, sometimes when you do lab work, the doctors can be gone when they get the labs in, and unless you call them, you won't know until you come back the next day to read the chart, if you're coming back the next day to look at it. So, yeah. And then they saw no evidence that he had traumatized it. Yeah. Yeah, it does. Because what it does is it widens the meat. Exactly what it does. Okay? So you want to be careful. Alright, apoptosis is programmed cell death. Phagocytosis or phagocyzing, and macrophages, they eat up the debris. So every cell has a suicide program, because every cell don't live forever. So cells have a life what? Expectancy, and you have things that will come in and help destroy them. Right? Tissue engineering is like grafts. When we try to manufacture or do things in the laboratory, like this one. Alright, genetic engineering. Alright, so this ends chapter 5, PowerPoint. Alright, so we're going to take a few minute break and get ready for lab. Any questions?